You can think of autoimmune disease as like the intersection of three main boxes. One is your genetic susceptibility, one is these regulatory failures that change how those genes are expressed, and third is environmental triggers like infection. Viruses can trigger it, hormonal changes can trigger it, smoking, UV exposure, photosensitivity, and stress.
Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hey ladies, welcome back to today's episode. I'm so excited to be joined by Dr. Sehreen Mumtaz, who is a board-certified rheumatologist. She is here today with us to talk all about autoimmune disease. Dr. Mumtaz, I'm so glad to have you here on Headed to Healthier. Autoimmune disease is one of those things that I see a good bit in my clinic, or even if I don't see it for sure, I think that I see it in my clinic and I go and start doing the workup. And then I think I need to find a friendly rheumatologist to ask some questions that I have or to send my patient over to. So I'm so honored to have met you and know you now that I can send my patients to you and also can just learn from you about autoimmune disease. And so that's what we're going to get into today. Would you mind introducing yourself to our audience, and then let's talk autoimmune disease?
Yeah, thank you so much for having me, for giving me this platform and opportunity. I'm so grateful, and thank you for all that you do and the time you put in to raise awareness of different health-related topics. So I'm just very excited to be here. So thank you. And yeah, autoimmune disease, of course, close to my heart. So I'm happy to talk about it. I completed my rheumatology fellowship earlier this summer, and then I just decided to go straight into opening my own practice. So it was a big leap of faith, and let's see how it goes. It's called Remission Rheumatology. It's a telemedicine practice licensed in multiple states. I'd love to discuss further about autoimmune disease and how it arises and what it means for early recognition and care.
Yeah, all right. Well, let's get into it. So, autoimmune disease, is something that, again, people will come into clinic, particularly women, and will report many different symptoms or signs that they're starting to feel within their body. Let's start off kind of broad. What exactly is an autoimmune disease, and how does it happen in the body?
Yeah, so at its core, an autoimmune disease is basically breakdown of self-tolerance. So when we all have like antigens in our body, like all the cells, we have self-antigens, and then they start attacking, like our body starts recognizing those as foreign. And because of this lack of self-tolerance, the immune system, whose job is actually to recognize and eliminate threats like these antigens, but also like cancer cells, in our body, it mistakenly mounts sustained responses against the body's own tissues. I do like to throw in an analogy of basically, I like to think of it as a smoke alarm. So, a smoke alarm not only goes on because of like a fire hazard, but also from like steam in a shower.
I love that analogy of it being like a smoke alarm, right? So not just, noticing the fire, but also when small things kind of start to happen, build up a little bit. We were talking earlier and you mentioned, kind of the checkpoints that we have in our body. But in autoimmune disease, it's almost as if your body's kind of attacking itself, right? And instead of those checkpoints saying, hey, slow down here, the body just goes a little bit into overdrive. That's how I think of it. Is that okay to say?
Yeah. So basically, you can think of autoimmune disease as like the intersection of three main boxes. One is your genetic susceptibility, one is these regulatory failures that change how those genes are expressed, and third is environmental triggers like infection. Viruses can trigger it, hormonal changes can trigger it, smoking, UV exposure, photosensitivity, and stress.
Gotcha. That makes so much sense. I feel like in my own clinic that I see autoimmune conditions more commonly in women. And that may just be, I may be wrong in that. That may be the population of people that I look for it in more. But I feel like it's more common in women. And, especially women in their 30s, 40s, 50s. Is that just my practice, or is that something that you see in true rheumatology practice also?
Yeah, that's a very smart observation, and that has been looked into, researched, and we keep learning more and more about it. So you'll be surprised that so basically up to three-fourths to four-fifths of patients diagnosed with autoimmune disease are female.
There you go. So it's not
Yeah.
just me, it's real.
Yeah, it's real. And this proportion varies by the diagnosis, like lupus and Sjogren's has more female bias. And this skew is the reason why we have so much X chromosome research. In fact, just last year at the American College of Rheumatology meeting, they had this very interesting discovery of cyst RNA genes that basically show how and why this happens more in females. So as females are going through their life course with puberty, pregnancy, menopause, these transitions, they alter the expression of autoimmune disease, which is why, like you said, that a lot of these diseases, like you'd see women in their 30s or after their 40s.
So I feel better knowing that it's not just me thinking that that's what I see in my practice. And certainly when we see some of these certain signs and symptoms that patients describe, we do the workup on everyone across the board where it fits, but it is often more commonly that I see those positive results and maybe more of those symptoms in women. One of the things that I love about the show and being able to do is to help women who are listening advocate for themselves, right? And one of the best ways that we can advocate for ourselves, for our health, is to know our bodies and to know what is going on with our bodies and to be able to express to our physicians what's going on in our bodies. And in order to do that as it relates to autoimmune disease, I think it's important to know what those signs are, those warning signs that people should pay attention to that may point towards an autoimmune issue. And I know that there are a lot of them. Would you mind sharing some for our listeners?
Yeah, of course. So these symptoms can be subtle, they can be non-specific, especially like females in their 30s and 50s. There are a lot of changes that are happening, like pregnancies, hormonal changes. Some of them are on birth control pills. There are other diseases like thyroid disorders that are more common in females as well. And then, of course, stress. So there's a lot of symptoms. So we have to look for clusters such as fatigue. Now, fatigue is very important, but having persistent, unrelenting fatigue that is not explained by lack of sleep or changes in mood, something that's persistent, like unrefreshed sleep. You have a 9 hour sleep, but you wake up feeling very unrefreshed. Now, that's a warning sign. The pattern of joint pain now, because of the way that we're in, like the lifestyle these days, there's a lot of typing involved, sitting on our desk. So we'll get some back pain, pain in our hands, but that's going to be more as we are like towards the end of the day. But the inflammatory pattern is more when you wake up in the morning, you feel swollen joints or you feel tenderness, pain that lasts like you haven't done anything. So you're just getting out of bed, but you need like more than 30 minutes for it to get better. And that pain is going to get better as you use it. So that's that inflammatory pattern to watch out for. And morning stiffness, yeah, morning stiffness lasting 30 minutes is another red flag. Now, we all have heard about that butterfly lupus rash, which is like on our cheeks after sun exposure, but a lot of us, can get sunburned. So it's more like if the rash is not going away for like 2 to 3 days, then that will be a photosensitive reaction. And if it's more over the sun exposed areas, but it's really not getting better until you get a steroid cream. And then it improves with that. So that's important versus rosacea or other flushing that can happen like with spicy foods, with heat, changes in temperature, stress. So those are differentiating factors. Mouth ulcers and hair loss, they can be hair loss with scarring or that's unexplained by other causes. And sika symptoms, which is dry eyes and dry mouth. We're using lubricant eye drops because of all the screens, but dry eye that's not getting better despite that, and then you can have it checked to an optometrist, and there are a lot of things that can be done these days for symptom relief, but that's all important because that can come not only with Sjogren's but with a lot of other autoimmune diseases. And then lastly, constitutional symptoms like fevers, weight changes, numbness, brain fog, these all can be overlapped with autoimmune disease. So they may not be a direct link to the autoimmune disease, but because of that unchecked inflammation, these symptoms start arising. So because of the sensitization in the body, so that's very important.
Right. And so you mentioned a lot of different symptoms and signs, and we may all have, one of these, right? Issues with sleep, or feeling like you sleep a whole night but are still tired when you wake up in the morning, or fatigue through the day, or joint pain, or dry eyes. But what I take from what you're saying is that when you start seeing multiple of these, right? And we're not giving any, specific medical advice or information here, but just what I interpret from what you're saying is when you start to see several of these at the same time, then you've got to think, all right, this is not something that's isolated, not a one off, but maybe this is indicative of something else going on. And there's so many different autoimmune diseases. You mentioned lupus already, rheumatoid arthritis is out there. You've mentioned Sjogren's. You've mentioned thyroid disease, and there's so many more. How do you, as a rheumatologist, go about diagnosing and sorting out which one of those a person has?
Yeah, that's a great question. The diagnosis is not only pattern recognition through like these subtle features, these clinical telltale signs, and the physical examination, but the labs form a big part of that. But you want to be careful about what labs you get because if you do end up with an incidental positive, which is not clinically correlating with your symptoms, you're just going to go down the path of more
Mhm.
incidental testing, and you may find positives, but again, some people have positive antibodies but they don't manifest. So that's why you want to be important about what test you get. Always like to start off with the basics just because the symptoms can be caused by other things. You always want to exclude common things first. So getting your blood counts, your comprehensive panel, your kidney function, your thyroid testing is very important. Throwing in vitamin D, vitamin B12 is very important as well. And then coming to inflammatory markers, being mindful, like if the patient is on steroids, then your inflammatory markers are going to be normal. So that's something to keep in mind as well. And then based on the symptoms, you start the autoantibody testing. Again, you want to just do the ones that you think are going to be useful. So these are some things that are essential for assessment.
Right. So realizing that you've got to take into account, the symptoms and clinically what the patient's saying. And what I take from that as a primary care physician is to not just go shotgun in labs, right? And ordering every lab you can think of, but really make sure that those labs that you get are tailored to what the patient is saying and kind of what things are more likely. Because to your point, the last thing that you want is to get a positive that, is a mildly positive, and that then you take yourself down the rabbit hole of digging for something that was just there because the patient was going to have those auto antibodies anyways, right? Which is where the beauty of rheumatologists comes in, right? And sometimes even, I'll see patients and I'll check labs and I'll get a negative, but something in the back of my mind is saying, this still sounds like it's autoimmune to me. And one of the things that I would encourage the listeners, if you have some of those kind of symptoms that Dr. Mumtaz mentioned, and you've gotten, an initial workup, and that initial workup seems negative, but that you're still having these symptoms, it can be devastating. I'd encourage you to seek that next source of help, whether that is, going back to your primary care doc and saying, hey, I know that we worked this up a little bit, but I'm still having these symptoms. What happens next? Or if it's finding, a direct care physician, rheumatologist like Dr. Mumtaz, who you don't have to have a referral to get to. You can seek them out directly. I mean, that's what direct care is all about. And so, Dr. Mumtaz, I want to interject. I want to go back and ask you about lifestyle factors here in a little bit, but I want to interject because I think this is a really good time to talk about kind of how your practice is set up and what made you choose a direct care practice and how you're able to kind of key in a little bit more to what your patients are feeling because you're not, pressed for time like so many of us are otherwise in practice.
Yeah, thank you. Of course, like with rheumatology, patients need time. They do need time with the physician. In these insurance-based models, they're getting like 10 to 15 minutes, and that after 3 to 6 months of wait, and then follow-up, good luck getting another follow-up for a
Yeah.
few more
Yeah.
months, and then just being on steroids to urgent cares. That was a big factor for me to really give patients that type of care in which they can get this access, yep, directly. So not only that they can get direct access, but they can also get that time. I give 60 minutes for initial patients.
60 minutes, 60
60,
minutes, like
yeah,
1 hour.
one
That
hour
blows
and
my mind. My patients would not know what to do if they had 60 minutes of access to me. But I can see when it is something like an autoimmune, like you said, these patients have been dealing with this for a long period of time. They have likely had to, try their best to get in with a rheumatologist if there is even one available. Where I practice, it is an hour away to get to a rheumatologist. And then to get an appointment is 4 to 6 months down the road. And like you said, you're in and out in 15 minutes, as opposed to really being able to sit down and go through the symptoms that you're having and get the help that you need and really feel like you've been heard. So tell us a little bit more about your practice.
yeah, thank you. So it is telemedicine, and I'm licensed in a few states, and I could list them out,
Yeah,
which is
please do.
Alabama. So it's Alabama, Florida, Georgia, Michigan, Missouri, Ohio, Pennsylvania, and Wisconsin. And it is telemedicine, but you'd be amazed at how much you can accomplish through that. Basically, you'd be surprised how extensive and how detailed the physical exam can be on telemedicine. That's a question I get asked frequently, and I'm like, yes, I can do the rheumatological exam, joint mobility, like contour deformities, inspection, having the patient do motion movements, and even impingement testing can be done. And then I can offer up to 80% discounted labs for these patients, imaging resources, and then also access to specialty medications, doing their prior authorizations and infusions, setting them up even for home infusions. So a lot can be done.
Well, I love what you're doing. I'm in Alabama, and I was so excited when you said that Alabama is one of the states that you do your telemedicine practice in. Because again, I have patients that I can think of right now who are, 2 months into a 6 month wait to get into rheumatology. So I think it's such a wonderful resource that you are providing, and you're so knowledgeable about it. We have, been chatting for a little while today, even before recording, and I love just your passion for rheumatology, and specifically your passion for autoimmune conditions. And I know that by the time patients get to you, they probably have been to several other docs who either have not thoroughly listened to them or have not been able to find out what exactly is going on with them. And just your passion for what you do is refreshing. And so, ladies, don't worry if you were driving or out for a walk or a run and you couldn't write down those states. I will plug them into the show notes for you so you can find them there. And hopefully, you are in a state that Dr. Mumtaz is seeing patients in if you need to see her. But then also tell us about your website because I want to plug that in and just anywhere on social media that folks can follow you as well.
Yeah, thank you so much. My website is www.remissionroom.com. So it's remission room is RHEUM, and that has links to our social media page, Instagram, which is Remission Rheumatology. We have a Facebook page.
I love it. You are a one woman show and you are doing all the things, including taking really, really good care of patients. And so I will plug all those into the show notes, www.remissionroom.com. And we are coming to find you on IG. And so you keep posting there, and we look forward to kind of learning more from you about just rheumatologic diseases, particularly autoimmune conditions. I want us to close in talking about lifestyle factors. That's one of the things that really is kind of a key returning point for the podcast. And, talking about, diet, stress, sleep, and what roles those can play in our health. Anything in particular we should think about those lifestyle factors as we think about autoimmune conditions?
Yeah. That's a great point that you brought up. So, lifestyle interventions. They won't cure the autoimmune disease, that they do meaningfully influence the symptom burden and resilience. So things that we can do is like optimizing sleep, reducing chronic stress with approaches including like therapy. Biofeedback mechanisms have shown to be very helpful, mindfulness-based breathing techniques, and basically adopting a whole food, nutrient-dense diet by really avoiding like processed foods, high fructose corn syrups. So these are actually practical levers the patients can use while they're getting their diagnosis figured out, while they're getting on the right treatment. And the treatment itself takes like 6 to 8 weeks to start exerting its full effect. So that's another thing to be aware of, but really targeting what you can do for your body. And by that time, there've been so many patients who've said, you know what, I changed my diet, so I stopped taking my medication. I feel so much better. A few months later, the disease relapses. But the point
Yes.
I'm trying to make is that the lifestyle can be a very good adjunctive measure to your medication. So those things go hand in hand. Yes.
Right. And I think that's so important with so many diseases, right? That, if we could make those significant lifestyle changes, that doesn't mean you can come off the medicines forever, right? But it's certainly what we realize, though, is that if you can make those changes, it really does go a long way in reducing some of the burden of the disease, right? So I think that's so important. All right, Dr. Mumtaz, it has been wonderful having you here. I want to give you final words. If there is anything kind of in closing that you wanted to share with listeners, whether it's about autoimmune conditions, your practice, or just any general health tips at all.
Thank you so much. So if this episode raised any questions about your health patterns, it's important to advocate for yourself, to document and be aware of all those symptoms, to really be in touch with your primary care provider. And then if you need the autoimmune referral, then yep, at Remission Rheumatology, we specialize in that, and we offer comprehensive consultations for musculoskeletal disease, but we cover much more than that, including osteoporosis, vasculitides, the whole breadth of autoimmune disease. And yeah, you can definitely go on our website and Instagram to learn more. We offer free initial consultations, and I will follow up and make sure you get the labs done. So that's something, if you are okay with, then sign up.
I love that. I think that patients are more than okay with that, having like the actual physician call them back, get everything set up, and really be attentive. And I think that that is the freshness that your practice is going to bring to the world, specifically to those 8 states that you're practicing in. And I know that you are young in your career and in private practice, but as a private practice doc who has done it and has seen it work and really feels like making an impact on patient health, I know that you are going to do the same. It has been an absolute honor to have you on Headed to Healthier today. We're all coming to follow you. I'm tagging where we can find you in the show notes, and I'd love to have you back. Well, let's talk about osteoporosis next time. I would
Oh,
love
yeah.
to have you. I'd love to have you come back sometime. Dr. Mumtaz, thank you so much for your time. We wish you all the best.
Thank you so much. I'm so grateful to you and your team for making this happen.
Deal. All right. Ladies, we'll see you here next week for another episode of Headed to Healthier. Bye. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.